Hey, welcome to Life After Nursing School. I'm your host, Caroline Dana, aka Nurse Coach Caroline, and I'm here to help you, the new nurse, thrive in your career. As a former nurse recruiter, nurse manager, and now your personal new nurse career coach, I'm obsessed with making sure you don't just survive your first couple of years at the bedside. I want you to absolutely rock them. From the challenges to the triumphs, I'll be right here with you, giving you the real-world advice and support that you need to shine. Whether you're in nursing school getting ready for life after, or you're already out there in nurse life feeling overwhelmed or even questioning your confidence, I've got your back. I'll be sharing tips, tricks, resources, and strategies that are just for you. We'll dive into everything from landing that dream nursing job to slaying imposter syndrome, and most importantly, how to keep that spark alive and stay the vibrant and amazing nurse that you are. So if you're ready to tackle the things nursing school did not cover, like how to build a career, trust yourself, and keep your passion strong, then get comfortable because we are about to dive in and make nurse life the best life. I can't believe I'm hitting record right now. To fill you in, it's 9 p.m. I am single parenting this week as my husband is traveling, and I just got all 3 kids to sleep. It's Wednesday night, and I leave for a week-long trip to Ireland with my mom early next week. I have nothing packed, and my to-do list is a million items long. To make matters worse, I have to get up at 4:30 in the morning tomorrow to meet my clinical group. And I know I should be in bed, but there is just something in me saying, let's just record another podcast episode real quick. It could be my ADHD or my entrepreneurial spirit, or maybe Mercury's in retrograde. Whatever it is, we're here for it. So if you are in the messy middle of life, just like me today, thank you for hitting play so that we can chat all things about nurse to nurse report. Before I dive in, I want you to know that I created an RN report sheet guide that you can download and use for free. Just head to the show notes for a link. Please know this is just a simple Google Doc that is meant to help you give a great handoff. You can make a duplicate copy of the document and make changes wherever you see fit. It is simply there to help you learn the skill of giving an effective report. Now, there is just something to be said for a good nurse-to-nurse report or handoff. If you are a nursing student, you will learn that starting your shift with a clear and complete handoff sets you up as the next nurse for success. With an effective report, you can likely determine your top priorities for the shift, you can anticipate struggles or challenges, and you have an idea of the workload ahead. You will hear me use the word report and handoff. Just know both of these terms are interchangeable throughout the episode and mean the same thing. What I'm referring to here is the communication practice that occurs between 2 nurses during change of shift. Change of shift is when the nurse who has been working and caring for patients for a set period of time, usually it's 4 to 8 to 12-hour time periods, is ending their shift by delivering a handoff report to the oncoming nurse who's taking over. As you may have learned from me sharing on this podcast, I'm a clinical nursing instructor and I have my students practice giving report to each other and the entire clinical group. I do this because it is actually quite a challenging skill to become proficient in, and yet can cause huge safety issues if not done well. I also feel the art of a nursing handoff is an important piece of the job that we don't emphasize enough in nursing school and also during the orientation process. It is actually funny. We learn many nursing skills in nursing school and even have many skills validation assessments or testing, yet we don't teach anything about how to deliver an effective handoff and what that would actually look like. So I want to dedicate this episode to the art of providing a good handoff. I think this topic resonates with me so much because when I first started working as a nurse, I absolutely did not anticipate that learning to deliver a good report, as well as the ability to take report from a peer, to be such a challenging skill to learn. You will find, if you haven't already, that you will work alongside many peers with different personalities and different learning preferences, as well as experience levels and communication styles. These all come into play when you are in rapport with another nurse. To ensure everyone understands this practice, I want to just set the scene quick. When you start your shift as a nurse in most hospital settings, you will begin by taking report from the previous shift nurse. For instance, day shift nurses will be taking report from night shift nurses. Report on the unit typically lasts about 30 minutes, but of course, this can be sometimes longer or shorter depending on the complexities of the patient assignment. You will also conclude your shift by giving report to the next nurse or the oncoming nurse. So this nursing practice is one that both starts your shift and ends your shift. You might be thinking, how hard could it be to give a report? Now, giving a report is not that hard, but giving an effective handoff actually takes skill. So what makes a handoff or report effective? In order to deliver a handoff that is effective, it is crucial we are providing a clear and concise verbal depiction of the patient's current medical status. And this is important because an effective handoff is critical for ensuring continuity of care, reducing errors, and promoting patient safety. Not to bore you, but I want to just emphasize the benefits of an effective handoff. Benefits include improved patient safety and continuity of care, reduced adverse events, better patient outcomes, enhanced teamwork and collaboration, increased efficiency, reduced communication breakdowns, improved patient satisfaction, and increased staff morale and staff relationships with each other. It is obvious that giving an effective handoff is extremely beneficial to all aspects of patient care, and it's beneficial to the nurse taking over care for the upcoming shift. So, what exactly makes a nurse handoff or report a good one? First and foremost, clear and concise communication. Report should be organized, clear, and succinct. Focus on sharing what is most important for the next caregiver to know in order to provide safe and effective care. I want to share a few statistics around communication in medicine. A study by the Joint Commission found that 70% of serious medical errors are due to communication failures. That's 70%. Another study performed by BMJ Quality and Safety reported that 80% of serious medical errors involved miscommunication during patient handoffs. In addition to these studies, ineffective communication is linked to 27% of adverse drug events and 37% of delays in treatment, according to the Institute of Healthcare Improvement. Yes, these statistics emphasize the potential detrimental effects that poor communication can have on our patients' well-being, but I want to highlight that I am sharing this information to protect you. The feeling you will experience someday if you find yourself in a position where you may be involved in a patient safety event is honestly a horrible and sickening feeling. We become nurses to help people, to save lives, and to provide compassionate care. But we are also human. A typical nursing shift is made up of various phone calls, monitor noises, alarm bells, constant interruptions, new orders, changing of treatment plans, and other unforeseeable events. Mistakes happen, and we are human. Whether it be a med error, a patient fall, or some other issue, it will leave you feeling sick to your stomach with guilt. And I hope you never have to experience it, but should you find yourself in a safety issue or involved in a safety issue, please remember, again, we're all human. We make mistakes. No one is perfect. In full transparency, I've made a medication error before, and although it did not harm the patient, that feeling I had will never be one that I forget. And I want you to have the tools to avoid those situations and to live your best nursing life. So yes, poor communication can affect our patients' well-being and obviously medical status, but it can also affect our own well-being. On the contrary, strong interdisciplinary communication has been linked to 15 to 20% reduction in a patient's length of stay, according to a study in the Journal of Patient Safety. Another study published by BMC Nursing found that nurses with strong communication skills have 30% lower burnout rates than those with poor communication practices. With that being said, communication is a very powerful tool, and when used correctly, it can help us provide the best care possible. So, what exactly needs to be communicated during handoff? Let's review critical information, and you may want to take a pen and paper out to jot this information down if nursing report isn't your strong suit. And again, head to the show notes to download your free RN report sheet guide. All right, I will use a pretend patient to work through report details in order to provide context around some of the advice that I'm going to give you. Okay, so it's very important to start every report with the critical patient identifying information. Okay, and this would include the patient's name or initials, room number, age, gender, allergies, and code status. So, for example, patient John D in room 8 is a 65-year-old male with no known allergies and is a full code. This helps to be clear on which patient that we are discussing during report, their demographics, and major safety concerns like allergies and code status. You should start every single report with this information that regards the critical patient identifiers. After this information, we want to next include the reason for admission or maybe the chief complaint. In other words, why did the patient come into the hospital and what are they currently being treated for? So back to our example, John was admitted on March 22nd with diverticulitis. After identifying the reason for admission, we can move on to medical history. This includes past medical history, which is like comorbidities and also past surgeries. John's past medical history includes hypertension, type 2 diabetes, and an appendectomy in 2021. All right, now it's time to move to current treatment plan. And the treatment plan includes medications that are ordered to treat the disease or illness that caused admission, upcoming procedures, planned therapies, and pending consults. John is receiving IV antibiotics, specifically ciprofloxacin, every 12 hours. Last dose was at 8 a.m. today. John is receiving IV Tylenol for pain, and this seems to be effective. John is NPO until surgery can evaluate him today, and they are unsure if he will need surgical intervention or simply IV antibiotics and bowel rest. All right, so that is the treatment plan. And after we share our patient's treatment plan, we can then move on to highlight other important care details such as abnormal lab values, vital sign trends, and any acute changes in condition, as well as assessment findings, I's and O's, etc. John's white blood cell count, CRP, and ESR are elevated. His vitals have been stable, but his blood pressure does tend to run high, around 150 over 85. His abdomen is distended but soft and non-tender upon palpation. John denies nausea, but also admits that he does not have an appetite. John voided 400 cc's of clear yellow urine over the 8-hour shift. At this point, we can highlight safety concerns like fall risk, infection control issues like precautions, skin breakdown issues, and any behavior issues. John is not a fall risk and moves independently in the room. Lastly, it's important to cover discharge plans or barriers, commonly discussed discharge topics such as recent bowel activity, portable O2 therapy, OT resources needed for home, nursing home or rehab preferences, and status of acceptance, as well as caregivers and family involvement. John lives home with his wife, and although we are not at the point of discharge, he will likely go home with his wife without needing any home therapies. Okay, so let's put all of John's report details together just for learning purposes. All right, so here is the full report. Patient John D in room 8 is a 65-year-old male with no known allergies and is a full code. John was admitted on March 22nd with diverticulitis. John's past medical history includes hypertension, diabetes, type 2 diabetes, and an appendectomy in 2021. John is receiving IV antibiotics, specifically Cipro, every 12 hours, and his last dose was 8 a.m. today. He is receiving IV Tylenol for pain, and this seems to be effective. John is NPO until surgery can evaluate him because they are unsure if he will need surgical intervention or simply IV antibiotics and bowel rest. John's white blood cell count, CRP, ESR are all elevated. His vitals have been stable, but his blood pressure does tend to run high, around 150 over 85. His abdomen is distended but soft and non-tender upon palpation. John denies nausea, but also admits that he does not have an appetite. John voided 400 cc's of clear yellow urine over the 8-hour shift. He is not a fall risk and moves independently in the room. John lives home with his wife, and although we are not at the point of discharge, he will likely go home with his wife without needing any home therapies once we are able to treat his diverticulitis. While that was a very straightforward report and example, there are other important details that you may need to include depending on your patient. And these details are patient specific needs. They include cultural considerations, maybe particular preferences and family involvement. It helps to make the patient feel as though they are being cared for as a person and not just as another patient or another number or another bed in the hospital. Let me tell you, it is pretty powerful to be able to enter your patient's room and introduce yourself and add in. Your previous nurse, Julia, shared with me that you go by Johnny and prefer that you have the lights dimmed and the door closed. Is that correct? It's simple gestures like these that go a long way with patients. This fosters trust and as well as a sense of confidence in the continuity of care. Now, I understand we are not going to pass along every little request that a patient had throughout the shift during report, but if they have a name preference, cultural accommodation request, or environmental preference, those are great things to share with the next nurse and implement throughout your shift. Okay, now that we discussed what makes a nursing handoff a good one, let's flip the script and discuss what makes a nursing handoff or report a bad one. Let's start with one of the most common reasons that a report is a bad report, and that is because of disorganization. A bad report is one that is disorganized, it doesn't flow naturally, or in an easy to follow structure. I want to be fully transparent with you here. This is where I struggled the most with report as a new nurse. Part of my disorganized report had to do with lack of experience, and the other part had to do with sleep deprivation from working night shift. But I'm not too proud to admit that this was always my biggest obstacle. You will know if you struggle with organization in your handoff if the person that you are handing off to says things like, wait, back up a minute, or I'm confused, or simply, huh? The best advice I have for you here is to use a report sheet that is laid out in a way where if you just start at the top and work your way down through the material on the report sheet, it will flow in an organized fashion. There are certainly other reasons for a bad report, not just disorganization. And a few of these reasons are not clearly communicating critical information to the oncoming nurse. The person giving report goes off on a tangent or focuses heavily on irrelevant information. The person giving report is using poor communication skills. The person giving report is distracted or rushed during report. And lastly, not allowing the person receiving report to ask questions or a chance to clarify information. Last month, my good friend Julia Joseph joined me to provide an effective handoff workshop to the members of the New Nurse Society. Shout out to Julia. She is just doing wonderful things in the online space for nurses. So please take a moment to look her up on social media. I'll include her Instagram handle in the show notes. Julia is an ICU nurse and has traveled for years, so she was able to provide great insight and tips when it came to giving a good report. One major tip that she shared with the New Nurse Society was that she recommended to end each report saying, did I miss anything? And this allows the person receiving report to feel empowered enough to ask follow-up questions. Opening the door for questions and encouraging questions is a great way to lean into safety culture while working as a nurse. Again, this is to protect the patient, but it's also to protect you and your license. Julia also explained to the New Nurse Society members that every unit and hospital is different. The cultures are different, and therefore sometimes one hospital might find certain information worthy of passing along in report, and then another hospital or another unit simply won't find that information as meaningful. She can speak to this extensively as she has had to accommodate her practice with each travel assignment she's taken. This is important to consider if you are floated or if you are in the float pool or if you decide to become a travel nurse. And this leads me into my next point, which is that each hospital, each unit, or and or clinical setting may have a different report or handoff technique or practice. Okay, so for example, some hospitals have bedside report where nurses give report to each other in front of the patient at the bedside. Other hospitals, most in my experience, conduct report at the nurses station. After report, the two nurses, the offgoing and oncoming nurses, walk over to the patient's room in order to introduce the next nurse to the patient. And I want to add that meeting the patient with the offgoing nurse is a really great opportunity to check a few things. Okay. Now you're in the room with the patient and you can check the rate or the status of any IV medications that are running or fluids running. You can ensure the bed alarm is on or the fall alarm is activated. And you can simply lay eyes on your patient, which will allow you to get an idea of their condition. It is also imperative that you use your clinical judgment to determine which details or pieces of report are relative and which are not. For example, if you just admitted a patient to the unit a few hours ago, it probably won't make sense to talk about discharge plans in report. As you gain experience, you will get better at using your clinical judgment when deciding what information to share in report and what information is not important. To help with this, make note of any follow-up questions asked during report. So, for example, let's say you give a report on our patient John D with diverticulitis, and the person receiving report asks, are they having surgery? And if you have not reviewed the fact that we're waiting for a surgical consult, then the person getting report is unclear of the treatment plan. So, follow up questions from more seasoned nurses while you're giving report can help you learn which information is important to the oncoming staff of particular units. I know I mentioned this already, but find a report sheet that you like and let it be your guide. Find one or make one that flows well with your thought process. Again, you have my permission to download the resource, the RN report sheet guide resource in the show notes. Make a copy of it. It's just a simple Google Doc and make tweaks and changes to it to best fit your clinical environment or your work environment and also your thought process. Not only is a report sheet a great tool to just help you give report, but it also acts as your resource at your fingertips throughout your entire shift. You can make notes on it, updates, add to it, add a to-do list, and that way at the end of the shift, you have crossed all your T's and dotted all your I's. It is also a great reference to have in your pocket should a doctor call you unexpectedly or you need specific information quickly as you're moving about through the shift. Nursing report is a skill that will evolve over time. I remember when I first started on a med surg floor as a new grad almost 13 years ago now, and I had a full piece of paper for each patient. On night shift, I had anywhere from 6 to 8 patients, so all of these report sheets were stapled together like a darn packet. But this is what worked for me. And as I got better at triaging what information was important to share and making changes to my report sheet, I eventually got all of my patients onto a single piece of paper. And I do want to make note here that that took me some time. Okay, all of this actually makes me think of this wonderful nurse that I worked with on the med surg unit that I started on. Her name is Patty. And let me tell you, she uses a very small piece of paper for her report sheet. Let me try to provide a visual. She would either like rip off or cut off a 1 inch strip of paper and use that for her report sheet for all of her patients. I also want to add that she's been working on that same unit for a very, very long time. So this is not the norm or expectation for new nurses, well, or even most nurses, to be honest. But my point here is that I am sure Patty didn't start with a small strip of paper for her report sheet. But over time, as she's gained experience and practice, her report structure evolved just like mine did, and yours will too. Okay, another thing I want to add too is that you will learn how to tailor your report to fit your peers' preferences. For example, you will know pretty quickly once you start working and giving report to your peers, which nurses want to know all about the family dynamics of the patient and they want to know everything about the head to toe assessment. And then you will learn the nurses that on the flip side, they just want the quick and dirty, just kind of the basics. They want basically you to just communicate any pertinent findings or changes that occurred on your unit. So you will learn those nurses that want a very detailed report versus the nurses that want more of a high level picture of what occurred on your shift. As you tailor your delivery to fit the preferences of your coworker, you may also find that you need to provide direction in the way your peers are providing handoff to you. You will find that you will need to redirect nurses during report if they go on a tangent or they get distracted. You may also find that you need to ask specific clarifying questions from certain nurses to ensure that you have the information you need to feel confident going into your shift. It really is important that you advocate for the information that you need when you're receiving report, just as your peers will do the same from you. Just because nurses may have years of experience under their belt doesn't mean they will always give you a good handoff. Depending on what events transpired during the previous shift, as well as the level of exhaustion your peer is experiencing, these things can all impact mentation and communication, which likely will affect the delivery of report. My last piece of advice when it comes to perfecting the practice of giving and receiving report is to use this time to perform a second check that all of your T's are crossed and your I's are dotted. To do this, get into the habit of pulling up the patient that you're discussing in report on the computer for reference. So you're pulling up their medical record and their chart and going through it as you're receiving report. As the offgoing nurse is giving you report, check to make sure all the meds have been signed off, the required documentation is complete, and I really cannot tell you how many times I would do this and see a med that was not signed off, and I would ask the nurse, hey, did you end up giving this stool softener that was ordered a few hours ago? More often than not, they didn't realize that it didn't sign off, and they did, in fact, give the medication. And at this point in time, they would then hop back on the computer and make sure to sign off that med. This really helps to eliminate any confusion that would transpire after the ongoing nurse leaves for the day. On the flip side, if you are giving report, again, get into the practice of pulling up the medical record on your patient on the computer and double check that you have completed all required documentation and all medications have been signed off. This will give you peace of mind when you leave and prevent your work from calling you, waking you up, all to ask if an unsigned medication overnight was given or not. Another practice that is worth implementing during report is entering the patient's room with another nurse to do a quick environmental check. I know I previously mentioned this, but it is a great chance to check and see, are the IV fluids or medications running appropriately? Is the IV tubing going to expire? This is also a great time to take a quick visual inventory of the patient's room. Are there any supplies that you can bring back with you when you return to do your head to toe assessment? Does this patient have the call bell within reach? Is the bed in the lowest position? How does the patient look? Believe it or not, you can do this mental inventory and visual scan in just a minute or two. This simple practice will help you anticipate needs, triage which patients you need to prioritize, and ensure your patients are safe and stable at the start and the end of your shift. I hope this episode has given you a deeper understanding of how important an effective nursing handoff is and some practical ways to improve your own nurse report skills. If you found this information helpful, I'd love for you to send this show to a nurse friend who could benefit from it too. Oh, and don't forget to check out your free RN report sheet guide resource in the show notes. Spreading knowledge and supporting each other is how we grow as a nursing community. Thanks for tuning in. As always, I have one hand for me and the other for you. All right, I'll catch you in the next episode. Well, that's it for today's episode of Life After Nursing School. I hope you feel more confident and ready to tackle the challenges that come with starting your nursing career. Remember, the first year or two might not be easy, but with the right mindset, you can overcome anything. If you found value in today's episode, I'd love for you to hit that subscribe button so you never miss a future episode. Also, please consider leaving a review on your favorite podcast platform. It helps so much in reaching other new nurses like you. Thanks for listening, and remember, you've got this. Take care and see you next time.